Hi, everyone. Thanks for joining. Just give us a couple more minutes to see if anyone else, and then we'll get started. All right, thank you for joining the second event in the Applied Basic Science webinar series. This series will be building on one another, providing a variety of topics that will come in handy to answer questions that may arise when adding CBD to your pet's regimen. Tonight, our focus is on CBD dosing and pet safety. We've brought in one of the authorities to teach us more, Dr. Stephanie McGrath. Dr. McGrath is an associate professor at the Colorado State University College of Veterinary Medicine and Biomedical Sciences. Many of you know her as the principal investigator and lead researcher on multiple clinical trials using CBD oil. First, the safety trials and the trials for epilepsy and other neurological diseases. We're so excited to hear Dr. McGrath's presentation on safety and dosing. Welcome, Dr. McGrath.
Thank you so much, Jessica. I appreciate the introduction, and thank you all for joining us this evening. I'm really excited to continue on our webinar series. It's so great, and it's fun to be here and be able to share some of the things that we've been learning about CBD and its safety, its efficacy, and its role really in veterinary and pet health. And so thank you, ABSC Organics, for inviting me back. So like Jessica said, for this webinar, we're going to be talking about kind of delving into a little more of the specifics regarding dosing and tolerability in our veterinary patients. So just to back up a little bit, and for those of you that joined the previous webinar, I apologize if some of this is old news right now, but I just want to make sure again that we're kind of all using the same terminology and that we're all on the same page. So just to quickly go over some of the words that we'll be discussing tonight and using, and to make sure that you are with me in terms of what I mean when I say certain words. I was going to just briefly review some of the kind of overall terminology regarding the cannabis plant. And so as a reminder, cannabinoids are the molecules that are synthesized by the cannabis plant. The two most commonly discussed, researched, utilized in the medicinal world are CBD and THC. CBD being the non-psychoactive cannabinoid that is produced in abundance by the cannabis plant. THC being also a very large component of the cannabis plant, but that is the psychoactive component. And so when we talk about our veterinary patients, we usually talk about products that are either very low in THC or don't contain THC, as we know that THC, at least at certain levels or dosages, can be harmful to our pets. We generally reach for very CBD rich products. And then as another kind of definition, we have the word hemp that will be thrown around a little bit in this presentation. Hemp being the cannabis, the variety of cannabis plants, if you will, that are grown and harvested in such a way that they don't contain very much THC. The level of THC is fairly arbitrary in terms of its, in the United States, being defined as less than 0.3% THC by dry weight in the plant. In other countries and other areas of the world, we have that kind of level change just a little bit, but the real overall point being that THC is fairly low in this in hemp plants, and CBD is usually very high or concentrated in these plants. And so the hemp plant does contain THC as well as other cannabinoids, and some you may have heard being used are CBG, CBC, CBN, and you may have even heard of terpenes or flavonoids. So the plant itself does contain a very wide variety of cannabinoids and other constituents, just not a lot of THC. And so again, for our veterinary patients, we tend to reach for hemp-derived products rather than medical marijuana due to that THC level. And so when I use the term THC throughout this, or sorry, CBD throughout this presentation, it usually will refer to the hemp plant that is rich in CBD, but it does often for these studies contain other constituents as well. So moving on, what, again, we're here to talk about tonight are dosing considerations and the safety profile of CBD. I would like to give the caveat that we are still at the very beginning of this research. And so although myself and other researchers have begun this process of really looking in a more scientific way as to what this this medication or product is doing to animals, in animals, and looking at species differences, et cetera, we are really starting what will probably be a very long process. And so I do applaud ABSC as being really one of the first companies to fund and really support the science side of CBD. But we still have a ways to go. And so a little bit of a spoiler alert, meaning that I'm here to give you some tips and to help you understand what we have learned so far, but that I don't have all the answers, that we still have to continue to do the research and to gather stories, to gather data, et cetera, so that we can continue to push forward in our more broad and full understanding. So a couple of things that I like to think about in my approach to CBD and our veterinary pets is, why are you giving it? So why are we reaching for CBD? what is driving this interest in giving a fairly experimental drug to our animals. So what are you treating? Does your pet have any other conditions? So are you treating a 3-year-old very healthy dog for separation anxiety versus are you treating your 15-year-old golden retriever that also has diabetes and cancer and 17 other comorbidities? And I think that that has to help kind of weigh into your consideration when you start talking about dosing and safety. What other medications is your pet taking? So again, we know very little right now about its interaction with other medications. And not to say that it is explicitly dangerous to give with other medications, but I do think, again, that should be a consideration when you start thinking about that safety profile. And then why CBD? So why are you choosing it? What form are you choosing? Does it contain THC and other cannabinoids? Is it an isolate? Are you giving it alone? And so I think trying to understand why you're choosing CBD and what your end goal is really helpful in starting to consider the product and the dose that you want to use. So backing up, while we start to answer some of these questions, I think it's important to understand not only anecdotally, so you'll hear lots of stories, but what are we finding on the science and research side of this market? And so far, we'll discuss a little bit more about dosing and safety on the science side. And again, our spoiler alert is that unfortunately, there's really not a lot out there to help guide our decisions. But again, we are starting to delve into some of those very questions and try to help come up with some answers. So I will say that there is some more information on the human side than the veterinary side. So some of the educated guesses that we use when discussing treatment and dosing does come from the human side of research. And so there are a number of active clinical trials. There's not, unfortunately, a lot that is published yet, even on the human medicine side of things, but there are a lot of active clinical trials, including trials into epilepsy, pain, anxiety, cancer, Alzheimer's disease, Parkinson's, and other movement disorders, psychosis, as you can imagine recently, COVID-related stress and burnout. So they are looking at it, and a lot of those clinical trials are based on preclinical trials. So there is at least laboratory evidence to suggest that CBD might help with a number of these different disorders. But again, does it also translate into helping with pets, and does it translate on the same level in terms of dosing? And that is yet to be determined in many of our disorders that we're interested in using CBD for. So on the veterinary side, like I mentioned, we do have some research to help support dosing questions and safety concerns. And so ABSC did sponsor a study. The first and I shouldn't say only, because there are a few others now that have sort of as a adjunctive aspect of their research project did look at a number of safety issues, but we looked at it in a very controlled and very strict dosing environment. And so there was a safety study published, and it's listed on the bottom right-hand corner of the slide, where we specifically looked at adverse effects associated with various administrations, with the administration of various doses, I should say, and formulations of CBD in healthy dogs. So we looked at dogs without comorbidities, without other medications. And again, it allowed us to do it in a much more controlled environment, and really start understanding what the drug may or may not be doing from a safety standpoint. And I'll delve into this a little bit more later on as well, but we were able to show that at least in the 6-week period that these dogs were dosed, that they did tolerate CBD very well. And so it was definitely encouraging And it also did serve to lay as a foundation for clinical trials. So it allowed us to sort of prove, if you will, that the drug was safe enough to give to client-owned animals with naturally occurring diseases and being dosed with other medications. So it did create a really nice foundation for future clinical work. And so there are, again, a couple other diseases that have been looked at in veterinary medicine, but the only published studies up to now anyway is an epilepsy study, again, sponsored by ABSC, looking at a clinical trial with client-owned dogs with naturally occurring disease. And I will, again, delve into this in the future as well. There are a few studies published on osteoarthritis and one on anxiety, but again, people are using it for a whole host of other diseases and ailments that dogs suffer from. And the anecdotal evidence certainly is encouraging, but again, we have quite a ways to go on the research side. So as far as dosing goes, it always kind of struck me when I started looking at this sort of at the very beginning, where I really didn't have a very robust basis for which to create my clinical trials. I really didn't know where to start with dosing. And so I looked at what people were using. So what are companies that are marketing their products online or in pet stores? What are they suggesting that we use? What is the anecdotal evidence? So what are people that are giving it to their pets? What are they finding works? And so just to summarize, I went through and looked at some of the usage that's kind of, in a popular sense out there, and finding that we had a range of about 0.1 to 0.5 milligrams per kilogram, mostly really around that 0.2, 0.3, 0.4 milligrams per kilogram, sometimes once a day, sometimes twice a day. But that's pretty typical of what is being recommended. And I apologize, it's in milligrams per kilogram, just to give you a sense. Kilogram is 2.2 pounds equals 1 kilogram. So to be totally honest, that's not really the point of this. The point is to help you understand that these doses that are out there are significantly lower than what we're using in a lot of our clinical trials. So I do think that potentially we can very safely go up on a lot of these dosages and potentially help more dogs, because certain dogs respond and certain don't. And so low dose might be fine for some dogs, and it might not work as well for others with more severe diseases or more severe clinical signs. And so to give you, again, just a sense of what's being discussed, we look at 0.1, 0.2, 0.3, 0.4 milligrams per kilogram. So to put that in perspective, for our epilepsy study, we looked at 2.5 milligrams per kilogram twice a day. So an order of magnitude or more, actually higher than what's being generally used by most pet owners. So quite a bit higher. We did not find that the CBD, that the dogs had any issues at all with the CBD itself, meaning that the adverse effects were, any that we did see were unrelated to the CBD. And so we found that at that dose, it was very well tolerated. And to be fair, that we're looking at epilepsy, which is a fairly severe disease. And often when you look even at other medications that have multi-purpose usage, it does often require a much higher dose. And so that's where we started with epilepsy. And we did see some improvement. And I think I showed this in the last webinar as well, but I really was I found this graph very striking, meaning that we saw the higher the CBD level that was reached in a particular dog, the greater reduction in seizures. And so more CBD seemed to correlate with less seizure activity. And so that 2.5 milligrams per kilogram worked really nicely when it was metabolized efficiently. Those dogs did really well in terms of seizures. But then the dogs at the other, kind of that top left side of the graph, those dogs never reached as high of a plasma level, meaning that the CBD was not absorbed as well as the dogs in the lower right. So they continue to have greater seizure activity than those dogs that achieved higher levels. And so, and all these red dot dogs received the same exact dose of 2.5 milligrams per kilogram of CBD. And so I thought it was a very interesting and very telling situation when it comes to CBD. I don't know that there is going to be a right dose for every dog across the board that we can say, give 5 drops of CBD and your dog will be cured. I don't know that that's going to happen. It might, but I question it because it's so individually metabolized so differently that I think that it's going to end up being a little bit more of an art form where we say, hey, you know what? Let's try starting at this dose and see how your dog tolerates it, see how it works. And then we may have to increase it or increase the frequency to get a better effect. And some dogs we might not. So I think, long story short, to answer the dosing question, I think some of it's going to be based on the scientific literature, but very, very variable and very different when it comes to different individual dogs with different diseases. Also, to put this all in perspective, there is a human FDA approved drug for epilepsy that's specifically is CBD, so it is hemp derived product, and this is the only hemp derived FDA approved drug at this point. And its starting dose is 5 milligrams per kilogram per day, so the same as what we used in our study. But they increased to a dose of 10 after a week. And then they have a maximum approved dose of 20 milligrams per kilogram. So again, putting that into perspective, often most of the products that I have encountered are recommending 0.2 milligrams or 0.3 milligrams per kilogram versus this is going all the way up to 10 to 20 milligrams per kilogram. Again, severe forms of epilepsy is what this drug is approved for. So take that, with a little bit of a grain of salt, but at the same time, I do think it's important to know that we may have a lot of room for increase if we need it. Switching gears a little bit and looking at pain. So like I mentioned, there are a few studies that have been conducted in veterinary medicine looking at chronic pain, mostly secondary to osteoarthritis. So a lot of our older dogs get kind of a degenerative joint disease where you'll probably have either seen or encountered with your own pet where they just are a little stiff in the morning. They have a little more trouble getting up. They can't jump into the car as well as they used to, maybe don't like stairs as much. And so a lot of that is just due to that kind of chronic discomfort in their joints. And so we struggle in the veterinary world with treating these guys. We don't have a great treatment for this condition. And as our dogs are living longer and longer, we're encountering this more often. And so the search for a superior drug to treat this particular disease is really on the forefront of a lot of the research and definitely on the forefront of pet owners' minds. So like I mentioned, there's been a few studies that have been conducted looking at the use of CBD for this osteoarthritic pain. ABSC also did sponsor a study at CSU looking at osteoarthritis, and that study has not been published yet. It was recently accepted, but hasn't been published. So that would be coming out soon as well. To add to that plethora of literature that was in the last slide. So for all of those studies, they looked at 2 to 2.5 milligrams per kilogram twice a day. Now, most of the studies have reported encouraging or promising results, but they haven't felt that it was so powerful that it would replace more conventional treatment. And so again, fairly high doses. And I think, again, we still have a little bit of work to do in this realm. And then lastly, as far as I know, only other published disease that's out there in the veterinary world is regarding anxiety. And these were done in shelter dogs looking at 1.4 milligrams per kilogram per day, so a little bit lower. And it has been anecdotally reported that you may not need as much CBD for a disease like anxiety versus pain versus epilepsy. And so we might be able to get away with slightly lower response or dosages here. Unfortunately, the study did show that it did not work. So it reported that there was no difference in the dogs treated by CBD versus placebo. And they were looking at specifically noise-induced fear. So they played tracks of fireworks and monitored their response before and after CBD. So they did question whether this dose might be too low. Maybe we do need a little bit more CBD in this disease. They also were wondering whether they gave it too early. So we see maximal effect usually around 2 hours or so after we give the drug. And in this case, they were giving it about 4 to 6 hours prior to the fireworks. So they were questioning whether it didn't work as well because they weren't giving it maybe at the correct timing. And then lastly, they also hypothesized that it is possible that some of the outcome parameters, namely they measured cortisol levels. So they would expect many of our anti-anxiety drugs work by decreasing those cortisol levels in response to an anxious stimulus versus in this particular study, they mentioned that maybe CBD works, but it doesn't work by decreasing cortisol. That's not the only way that we can measure response to anxiety changes. And so there was that thought as well. And so I guess overall, to me, I'd like to sort of sum all of that up by saying that there's probably a very large dosing range. It's probably going to be incredibly variable for different diseases and potentially even for different dogs. So again, just to point out to that graph, our dogs metabolize it all different. They all metabolize it very differently. So dogs given the same dose might not metabolize it in such a way that they are absorbing it as well as another dog. And so some dogs may get away with lower doses than dogs that are not able to absorb it as well. They might require higher doses. So we have different diseases. We have individual variability between our dogs and other patients for that matter, cats, horses. And then we also have different, the bottom right graph is representative of our pharmacokinetic curve. And all that means is a fancy term for how well and how differently dogs are absorbing the medication. And so you can kind of ignore most of the lines. The only real point of putting this up there is you can see these little bars probably. So each of the little dots, no matter which line you're looking at, has a range as a little vertical bar next to it, or overlaying it, I should say. And those represent the range. So the average is the little dot, but then the range is that line. And so as you can see, even in that graph, dogs, again, respond very differently to the exact same dose of the drug. So my take-home message regarding dosing is that unfortunately, there's not a lot published, but there are a few published studies. And I think that we can use those to start looking at some of the diseases that are commonly treated. We do have a reasonable amount of anecdotal evidence. And although I'm a scientist and I do like hard and fast controlled clinical trials to base my knowledge on, we don't have that right now. And so until we, in a decade from now, have a ton of information about CBD in pets, I think we do have to consider and think about anecdotal evidence. So if your dog responds to CBD for his arthritis, what dose are you using? How are you giving it? What kind of product are you using? Are you using pure CBD or are you using full spectrum? And so I think starting to gather and understand some of that anecdotal information is really helpful. I would also encourage everybody to work with their veterinarian if they're willing. Some veterinarians are not, but I do think that they have very kind of first line access to a lot of these published studies. And so I think working with them to start understanding what doses might be working for certain diseases is really going to provide a lot of assistance and a lot of guidance for this journey. I think having a clear picture of what you're trying to treat. So I've even talked with pet owners and literally had them write down what they're using it for, why they're using it, what other diseases does your dog have, what other medications, and kind of building that whole picture so that we can help create a safe environment for the CBD usage. Closely monitoring pets for adverse side effects, I think, are really important. So really almost keeping a journal of, I gave this product at this dose and my dog did really well, or my dog seemed a little sleepy, or my dog ate really well, whatever those changes are, I think will really help, especially if you're working closely with your veterinarian. At least I know from being a pet owner that I go in and I feel like I have a very clear picture of what I'm trying to express, and they ask questions and I'm like, oh my gosh, I don't know. I don't remember when that happened or if that happened. So I think keeping almost like a journal of what you're seeing, it would be really helpful. My other really important, I think, take home message is to start low and titrate up. So there's no reason, in my opinion, to go high. I don't think that this should be a replacement for conventional therapies, especially in severe diseases. So, if it's just trying to keep a decent quality of life for as long as possible, great. If your dog has diabetes and needs conventional therapy, then I think this should not be a replacement, at least at this point. And so, in my opinion, you're never needing a super rapid response. And so I would advise pet owners to start low and then titrate up. So see what a lower dose gives you, and maybe you can get away with it. And, not only for your pet's benefit, but your wallet. I mean, if you can get away with a lower dose, great. And then if it's not working, at least you can start moving up, every week, every few days, until you get to an effective dose. Feeding with meals has been shown to be helpful. So it does tend to increase the absorption of CBD. CBD by nature is a very, what we call lipophilic. So it really likes fat. And so it can be really challenging for our body to absorb it. Whereas if it's taken with a meal that has fat in it, obviously, then that can really help with the absorption. And so that's another thing to try. Carefully consider the products. So again, look into the company. What are you giving? Why are you giving it? And is this the right product for you and your pet? And so I think that can also be really helpful. So we'll delve a little bit more into the specifics of the safety side of things for the next few slides. And so here we have kind of oftentimes this thought that more is better, and it's not necessarily true. So you have to reach a really good balance. I know I've been saying you can probably give quite a bit without harming your pet, but we do have potential adverse effects to consider. And so again, my last slide mentioned start low and titrate up. I still think that's a really good, that's really good advice. And so more isn't necessarily better. We do have potential adverse effects. And these, again, I don't know what to make of them right now. I know that we've seen some changes, both clinically as well as on blood work, that make us at least want to continue to monitor that situation and make sure that we're not causing any long-term or chronic effects. So things that we have seen are, in a few studies, we've seen diarrhea in some dogs. We have seen some liver enzyme elevations, and I know that's a little bit of a mouthful, but really what we've seen is that the liver is pumping out more enzymes than it normally does. So when we give CBD, in many of our dogs, we have seen that the liver kind of is almost in overdrive. So it's working a little bit harder. It's pumping out more enzyme that we're seeing in the blood. The question is at this point whether that's of concern. So far, we have not seen that translate into liver damage or liver toxicity. many drugs, including a lot of our anti-epileptic drugs and even our some of our chronic pain medications, our NSAIDs, will cause changes in liver enzymes without ever causing liver damage or really any other concern. And so I think a great example is one of our most common anti-epileptic drugs is phenobarbital, which tends to almost every dog causes liver enzyme elevation and very, very rarely causes any kind of liver damage. And you can give, I mean, I'm a neurologist by trade, and I give these dogs phenobarbital for 10 years, and their liver enzymes just sit higher than other dogs, but there's, again, almost no cause for concern. And so, but I think the jury's still out. So I don't think we know whether that's a more serious concern or not. I will tell you, we have studied, at least in a short-term arena, we've studied the effect specifically on liver function, and it has remained normal in every dog that we've looked at. So at least in a short-term sense, I don't have any concerns, but again, it has yet to be really proven in more of a long-term fashion. And so vomiting, diarrhea, we've seen very intermittently. It's reported on the human side as well. And so I would say in that circumstance, I would monitor some dogs. Like I've had a couple dogs we've started on CBD and they vomit once and then they're fine. They go on to take it for months with no further problems. So I would obviously definitely pay attention to it and keep that in mind as a potential adverse effect, but I would monitor it and see how your dog responds and how he handles it. Lethargy, so we have seen a few dogs that have become a bit more lethargic and ataxic. I will point out that those side effects were specifically noted in the study on the bottom of the screen, which is a study of escalating doses, and they went up to 62 milligrams per kilogram. So again, to put that all in a kind of relative perspective, we have 0.1, 0.2, 0.3 suggested online by most products. We have many of our studies are using 2.5 to 5 or even 10 milligrams per kilogram. This study went up to 62. That's a lot. And the lethargy and what we call ataxia, or kind of drunken walking, wobbliness, was seen at the higher dosages. So that's a lot of CBD. And so, so take that for what it's worth. I mean, I think it's important to note, but I would be surprised if that were a major issue at the doses that we tend to reach for. Last kind of concern, in product selection, we do have to be careful about THC. Now, in general, it is considered harmful to our pets. I will kind of hopefully make it clear that that's at certain dosages. So there might be trace amounts of CBD or THC in our CBD products. In fact, the products that I use for my studies with ABSC has very small, low amounts of THC, and I don't tend to see any concerns at that level. But once you get into higher dosages, so for example, I have owners that say, well, I went out to the dispensary, I bought medical marijuana, it helped me so much with my pain that I gave it to my dog. And then the dog is, a drunken sailor and his eyes are dilated and he's noise averse and he can't walk straight and all of these things. So meaning that at higher levels of THC, we do have to be careful. And so make sure that you're choosing a pet product, make sure that THC is low. And in that case, I think you will be fine, but just putting it out there that we don't want to just hand over our pot brownie to our pets and expect them to be fine, because they likely won't. So again, things to watch for, and I would, as I did before, really encourage you to work closely with your family veterinarian if they are amenable to helping you through the process. Lethargy, vomiting, diarrhea, wobbliness are kind of the more common clinical signs that we see. They're not common, they're rare, but of the side effects that we see, those are the most kind of discussed and signs that you should be monitoring or watching for. Monitor liver enzymes for sure. Like I mentioned before, we don't know exactly what it does in a long-term sense to the liver. personally, I think it's safe. I can't prove that, but I feel like in the several month studies that we've done without seeing any other signs of liver concerns, it does appear that it just makes the liver a little leaky, produce a little bit more enzymes than it normally would, but I haven't seen a cause for concern. But that being said, again, we don't know. So definitely monitor, especially if you have a dog that has known liver disease. This may not be the right choice for you. If you're using other drugs that are metabolized by the liver, that might also be something to really keep a close eye on. And in that same sort of sense, the next bullet point is monitor concurrent drug levels. So make sure that you're looking at what the other drugs are. So this is especially important with anticonvulsants. We don't tend to monitor drug levels for other medications, but for epilepsy and anticonvulsants, we often will monitor those levels. And right now we don't know necessarily what it does. We don't know that whether it will increase or decrease those other medications. And so it's something, again, just to keep an eye on with your veterinarian. And then, like I mentioned, try to keep some kind of a journal or diary that's outlining the response to CBD. So what dose did you use? How did they respond? Did you see any adverse effects? And I think all of that information becomes really helpful, not only to you and your family, but to your veterinarian. And then, not to end on a negative note, but I will also reiterate that it can be a tough market. It really is a buyer's beware market. There are companies like ABSC really being on the forefront of this, but companies that do support the research and the science and really have amazing products and have a lot to offer. But then there's also, unfortunately, a lot of companies that are not as transparent and not as honest as some of these other companies. And so it really is a bit of a gamble. There is no regulation, there's no oversight. And so, so I do always caution owners to be a little bit careful in the companies that they're buying the CBD from and the products that they're using. And so this is just a couple articles that were published. One was a few years ago in a human journal looking at CBD extracts sold online, and they found that 69% of them were mislabeled. So 43% had more CBD, 26% had less, and that was all already allowing for a 10% variance, meaning they already allowed for a range of CBD within the labeled product, and that they still found that almost 70% of those products were outside of that accepted range. And then on the the veterinary side, we had a study that was published in 2020 looking at different over-the-counter CBD products, and they found that 10 of the 29 products that they looked at were accurately labeled, meaning 19 of them were not accurately labeled, again with that same accepted 10% variance. And so really a challenging world to navigate, unfortunately, when it comes to hemp and CBD. And I thought that was kind of funny. Well, not really, but 2 of them had actually no detectable CBD at all. And again, there's no oversight. So they can put whatever they want on the labels. They may get a slap on the wrist, and that's it happens. But otherwise, it really is a challenging place to navigate. And so I do encourage you to do your due diligence, look for products that are transparent, companies that support research, companies that can provide you with a certificate of analysis for their products, et cetera, and to try to just be as diligent as you can about your product choice. So do your research and due diligence, work with your veterinarian, and stay up to date on the current information that's out there. Use CBD if you want. I don't have any issue with that, obviously, but use it slowly, use it cautiously, and monitor for changes, good or bad, that might occur, so that you can help make good choices. Pick the right product and dose for your pet, and I think that will really make all the difference. And enjoy. It's a fun. I don't mean to end on a negative note. I do think that there are amazing companies and really amazing products, and CBD has been used for about 10,000 years medicinally. And so I think there is a lot to be said for it. And I think it can be, I mean, for me, it's fun. The research is really fun. And I think that's what it should be for pet owners as well. So, enjoying the process and recognizing that it's a bit of an art, and that it's a journey. But I think that it can be a really useful one. I think that it has the potential to really help. And I think that it can be very, very rewarding at the end. So hopefully that helped and didn't confuse you guys too much. The last thing I did want to point out is that the dosing, I recognize everything was in milligrams per kilogram. I thought about all different ways of presenting it. I think that overall it's really challenging because all different products will report things differently. So people talk about drops, they talk about milliliters. They have all different strength bottles. So 1 milliliter might contain 50 milligrams of CBD in this bottle, and it might contain 2 in that bottle. So to talk strictly, give your dog 5 drops of CBD is not practical. And so I suggest, and I mean, even personally, I deal with it all the time, but any veterinarian can calculate your dose. So I literally have pet owners send me a picture of the product that they buy, the label, and I will calculate the dose for them. So you just need to know how much your pet weighs, and you need to have either a product in mind or physically in possession, so that you can help work with your veterinarian, so they can help you pick some starting doses and some maximum doses. So I recognize that's a little confusing, but unfortunately I don't see a super simple way to talk about it. But again, your veterinarian, I'm sure, can help you with those calculations. It's fairly straightforward. It just takes a little bit of translation from product to product and dog to dog. So anyway, on that note, thank you so much once again to ABSC Organics, not only for inviting me to present this webinar, but also for their continued support and funding of research that we are continuing at CSU. And with that, I will take any questions.
Thank you, Dr. McGrath. So one of the first questions I have is around, if all CBD products are safe. And I know you touched on inaccuracy of labels and, misrepresenting how much CBD is actually in a product. Would you say that there are other ingredients that pet owners should look out for when selecting a product?
Yeah, definitely. That's a great question. Thanks, Jess. I have just backtracked a little bit to this slide because I didn't delve into it too much, but yes. So there, not only is there certificate of analysis important, meaning how much CBD is in the product. So if it says that this bottle contains 500 milligrams of CBD, does it actually contain that? And that's where a certificate of analysis comes in. But it also gives you the other constituents. So does it have THC and how much? Does it have the other cannabinoids? You might be interested in using CBG or CBN or CBC. There are other, at least, discussed benefits of some of these other cannabinoids. And so are there at least trace amounts of some of these other cannabinoids that you might be interested in? The other thing that a lot of companies will provide is a analysis of the integrity of the product, meaning does it have heavy metal contamination? Is it free of mold? Is it free of other contaminants? And so a lot of that can also be gathered from companies. And so, yes, I think that there are other potential concerns that might be in a product. And I brought this slide back up because in that veterinary study that came out this year, looking at these over-the-counter products, they found heavy metal contamination in 4 out of the 29 products, which to me is a lot. There should be 0 of the 29 products that have heavy metal contamination, and that was mostly lead. And so there are certainly concerns about other constituents. And again, even on the THC side, in the first study that's listed there in the human study, they found that THC was detected in 18 of the 84 samples, so 21% of their samples. and that it was detected at a level of I'm just reading my notes, 6.43 milligrams per mil, which they concluded was sufficient to produce intoxication or impairment, especially in young children. So these are products that were labeled as CBD, hemp-derived, low to no THC products, and they found potentially intoxicating levels in almost a quarter of their products that they looked at. So point being, yes, there are concerns, and there also, again, might just be benefits that you're looking for that you want to ensure are in those products. And so again, that's where the right company, the right product, the transparency, the connectability. So can you get somebody on the line or on email that can answer some of these questions and make you feel good about the product that you're buying, and have third-party lab verification that these products are what they say they are, I think is all a really important aspect of choosing CBD products.
Awesome, thank you. Are there medications for which CBD would be contraindicated? Indicated? Sorry, stuttering.
Sorry, are there other? Do you
Are
say
there
other?
Yeah, other medications in which you shouldn't be having a pet take CBD with?
Yeah, and I touched on that a little bit, but to expand on it a little bit more. So we do know that CBD is metabolized by the liver. That's true on the human side as well as in our at least canine patients, probably all of them, but definitely in the dog. And so there are concerns is probably too strong of a word, but at least I think we should be paying attention to other drugs that may be metabolized by the liver in terms of that drug-drug interaction. And so that's where I focus most of my thoughts on when it comes to other drugs and its potential interaction with CBD. And it's not necessarily a negative one. It's not that I think that if a drug's metabolized by the liver, you have to avoid CBD at all costs. It's more of a question of what they're going to do to each other, meaning does it, for example, if a dog is on drug A and you give CBD, is it going to cause drug A to go up? So do you absorb more of drug A or do you absorb less, or does it not change at all? And I think that's where we have to be a little bit careful, because if we're giving a drug, for example, for heart disease, that we don't want CBD to mess with that drug, then we might have to give a little bit of thought to using CBD. Maybe it's not the right choice in that dog. Maybe it's a question of, like I do with my epileptic dogs, maybe it's a question of just paying attention. So if you gave CBD and the seizures stop and the dog's also on another anti-epileptic, it probably didn't cause any major harm in the level of that other drug. If the seizures get worse, then maybe you have to give a little bit more of drug A to make sure that you're still maintaining a good blood level. And so that's kind of where we don't know a lot yet, to be totally honest, and that we're still trying to figure out, is it safe to give with other drugs? Is it going to cause any changes in those other drugs being metabolized? So is it going to cause greater or lesser efficacy of those other medications? And so really the drugs that are metabolized by the liver, which your veterinarian should have a good handle on, would be the ones that I would probably pay most attention to.
Okay. So can you compare dosing to animals the same as humans? For example, there are individuals who are prescribed a dose of 4 aspirin or a different drug versus what's actually put on the label.
Oh, I think I understand. Are you asking, is a question, do you think, is it, so a company might say, our suggested dose is 0.2 milligrams per kilogram, and your veterinarian or you may want to give more. So your veterinarian may say, I know it says this on the label, but I think you should give twice that amount to be effective in this disease. Is that what the question is?
Yes. And you kind of touched on certain conditions and things in which that might be relevant. So I was just hoping to understand a little bit more.
Perfect. Yeah. Thanks, Jessica. So and I did touch on this. I think that it absolutely is the case. I mean, keep in mind, these companies are starting at the same spot that I'm starting, which is basically we don't know. So we're looking at what do pet owners describe as helping? And to me, honestly, that's oftentimes what I use to start my studies is polling people and saying, what do you use for this disease and does it work? And so getting an idea of dosing as we're all starting at essentially at the beginning. And so I think we're all learning as we go, so to speak. So yeah, I think it's going to be very common that we have, a um, suggested dose, and your veterinarian or even, educated owners after reading something, a scientific article may say, gosh, I don't know that that's going to work for my disease or for my dog with this particular disease. I think I might have to give more. And that's, I think, really reasonable and going to be a really common. I think it's going to be really hard to have this kind of blanket, every dog with every disease should get X amount of this drug. I think that's just impossible. So again, that kind of speaks to what I was saying in a couple slides that I presented, which is start low and go high, and titrate up until you get the desired effect that you were looking for without any adverse effects. And I think that's going to be what we're stuck with for a while. And I think that, again, I think that's okay. I think if you go into it with the right attitude and you are willing to kind of go on that journey with your pet, I think that it can be fun, but definitely you can't, pinpoint one dose and say, well, gosh, I gave 0.1 milligrams per kilogram. That's what the bottle said. It didn't work. This product stinks. I mean, that's just not reasonable. I think all of this is going to be a lot more of an art form than anything else right now.
Awesome. And then my last question for you is, do you need to do a CBD reboot? Or in other words, stop dosing for a few days and then start back up to keep it effective?
Unfortunately, Jessica, I would say we still don't know. There certainly is talk of that. And I think from what I've seen or heard about on the non-scientific, more anecdotal side, I think that might be a consideration in many pets. I think that there might be some value to giving the body a break and reintroducing it several days later. And that happens actually in a reasonable amount of the drugs that we do use in medicine. That's not an uncommon occurrence. That being said, I also have seen really nice levels in our studies. So for example, epilepsy studies that we've been doing have shown really nice cumulative effects. And so in those dogs, I would not stop that medication because I think it maintains a really nice level, and we're treating a disease that, gosh, we can't stop it and risk this dog having a bunch of seizures over the weekend so that we can reboot. Versus a dog with chronic pain, it probably is okay to give the dog a little bit of a break, especially if they're on other medications. So I hate to be wishy-washy and vague with that answer, but I think that's it's just not determined yet. I don't think we know.
Well, thank you so much for your wonderful presentation and answering the questions that were presented to us. We really appreciate your time, and we appreciate everyone for joining tonight, and we will see you all again.
Bye. Thanks, Jessica. Thanks, ABSC.